Ora, boa noite a todos, sejam bem-vindos a mais um APAMTC TALKS. Estamos aqui hoje com dois professores que já estiveram em Lisboa, Shaun Goodman e Gil Tom. Thank you guys for having here again in APAMTC TALKS. Shaun and Gil, welcome.
Thank you for having us.
It will be a pleasure. I'll do a small introduction for you both, for the people doesn't know a little bit of your background. I will start with Shaun Goodman, that he started 30 years ago his practice in Israel, and then 15 years ago he started the practice of meridian theory and master Tung's acupuncture. He has been teaching in Reitman College in Israel, and the effort in the last 15 years, it was related with Dongshu acupuncture and channel theory, if I'm correct. And Gil Tom has started in Israel in 2007. He's already did the doctoral degree in Taiwan. His research was based on laser acupuncture for chronic facial paralysis. In 2015, he traveled to Taiwan. He did the studies for 6 years, and he has the pleasure to be a Wangzhui student for 1 year in Beijing, if I'm not wrong, in 2011. Correct?
Yeah.
Yeah, great. Well, today we are here to introduce the 2 courses that we will have in December in Portugal, and we have foundations and advanced course. Maybe Gil, you can start a bit spreading the word about foundation, and then Shaun, if it is okay, you will progress to the advanced course that will have diagnosed, palmar diagnosed, and bloodletting. Okay, the floor is yours, guys.
Okay. Great to see you again, Pedro, and thank you for having us. It's a great pleasure to collaborate with you, and we are looking forward, both Shaun and I, to come again to Lisbon. A year and a half ago was a pleasure experience for us, and we are looking forward to come again. I'm coming from Amsterdam, as you can see in the video. I'm enjoying the beach in Amsterdam, and Shaun will come from Israel, and we are very looking forward to introduce the Portuguese practitioners, Master Dong's lineage of acupuncture. It's a very unique, distinctive style of acupuncture. Originated in Taiwan, became very popular in Taiwan in the late 60s and mid 70s of the last century. It has very strong origins in China, in Shandong origin. It's known because of its highly clinical efficacy. It's spreading the last 15 years and more due to its clinical efficacy, I think. I'm here in Amsterdam the last 4 years. I'm based in Amsterdam, and my clinic is here. And in the last 4 years, my clinic is going very, very well, not because of my nice smile, I think because of the clinical results. So the foundation course will be the gate to start and to open and learn a new perspective of channels, and to understand how to use the fabulous points, new points, many new areas like the fingers and the thigh, different areas and zones that we usually don't use in orthodox acupuncture, in the traditional acupuncture. So in the foundation course, which is a very comprehensive course, 36 hours. We will understand the principles and the foundations of this style of acupuncture, and we will learn the points and the combinations and how to use them in a clinic in many different types of diseases. So foundations is a great beginning to start and going deeper into this style of acupuncture. Shaun, you want to add something?
No, I just maybe that it's not only, it's also what's special about Ma Dong's acupuncture. It's also an opportunity to look at acupuncture in a different perspective. And I think what's so special about Ma Dong's acupuncture is not only the points, it's the principles behind the points. And that's what's very important to understand. And that's what we teach. Our teaching is based on the principles. And from the principles, we study the points. Yes, I think that's about it.
Yeah, and it's important for the people that didn't attend last year to understand that to have concepts of different from reflex area or shenjing and all that knowledge that is needed for starting to studying Tung acupuncture, because everyone can buy a book, right? But the way to understand the principles, as Shaun is saying, and the practice, how to needle, how the depth, and I believe we are having a nice talk here. Shaun, even the tip of the needle is the perception of the position, correct?
Yeah, it's the idea that
The idea for those who doesn't know that or they attended late, Shaun has one amazing app that has been on the market one year, not that much.
Yeah, 1 year.
1 year already. Okay, yeah. That's a very amazing tool for the practitioners to keep after the foundation, to keep and be able to keep using Tung's acupuncture and allow the clinical practice to reach the levels that Gil is saying. Like, not about the smile, right? It's about the tip of the needle on the right place. So can we move on a little bit on the advanced course to see what are the content for the advanced course?
So the advanced course is a 3-day course. It's a frontal course, and the first day we'll be talking about sangria, bloodletting, and bloodletting is a very important aspect of Chinese medicine, not of only Ma Dong's acupuncture. And but in Ma Dong's acupuncture, it's performed in a very broad way. I started using bloodletting because of Ma Dong's acupuncture. Before, I used only a few points. And bloodletting is a technique that really makes the results much better. For example, one of Ma Dong's students, Dr. Hu Wenzi, if you go to his clinic, he closed his clinic, but when he practiced in Taipei, he gave you two options. One option to have a long treatment and only do acupuncture, or a much shorter treatment or using bloodletting. So bloodletting is a very powerful technique. And on this first day, we'll learn the idea, why do we do bloodletting? Because it's like the principle why we do bloodletting in Chinese medicine, and also how to perform bloodletting in a lot of ways. I think this course is a very good course to take, even if you don't practice Ma Dong's acupuncture. It's a really door to go into using bloodletting in your practice.
Yeah, for those who didn't pay really attention to it, the blood letting day, it's a different a single day that can be taken on advanced course. If people are interested just to learn more the way to approach a bloodletting based on Dongshi acupuncture and the benefits of the use of the technique. I would like to ask if I'm doing and understanding it correctly. Do you believe the use of dorsal and ventral bloodletting points were more effective on those times because the maintenance of the disease are very lower than today? The medicines today are more effective. What do you think? The chest and the lung and all the areas. What do you think?
Yeah, I think they didn't have medicine, so they used the bloodletting on the chest and the thorax. But the truth is, I've seen a lot of good results using bloodletting on the back. It's a very powerful technique. And it's like in Master Dong's acupuncture, they do bloodletting on the back instead of needling. And I think that's what the students say. They say because they don't want to needle deep. So they did bloodletting instead because they don't want to harm the organs. So bloodletting is very superficial on the back. And it's different to the bloodletting we do on the body. But I've seen patients with stomach conditions and also gynecological issues and also lung issues. Bloodletting makes a very big difference. Okay, but it's not something. It's very delicate. It's called what we call micro punching. We just like pinch the skin and take a drop of blood out.
Yeah, and allows the blood to circulate and influence that area too, right? Yeah. So I received some questions during this week, and I will just make and if someone on the room has questions, please feel free to write it down. One question that was introduced to me that was like, in this system there are so many points. How can we memorize all that? Because the channels doesn't being used like we are taught in TCM. So you have any particular idea to share with the people that think this way?
Gil, you go for it? Or...
Well, in order to be a very good clinician, we need to memorize. There is no shortcuts in that sense, but well, the moment we understand better that there are certain principles and the focus of the style of acupuncture, Master Dong's acupuncture that we bring is more coming from Dr. Hu and Zi, as Shaun mentioned, and practitioners, disciples of Master Dong, first generation disciples of Master Dong from Taiwan, is that we bring this approach of the 5 Zhang channels. And the moment we understand better how to locate the points according to the 5 Zhang channels, we understand the principles behind the points, just as points, as extra points. We have a better way to observe what the points are doing. And then we have a better way to memorize them. But in the end, some memory skills are important here to become better. And in reality, in the clinic, through our patients, we learn how to use these points. So the moment we get the results from using the points, we just know better how to navigate with all of those points. And actually, they are like, I would say, master points. They are about, I don't know, 60 to 80 points that they are so-called master points, and they are main points to be used. And then there are more specific points for specific conditions. And in our course, we will learn about 100 to 120 points. And there is more to learn. And there are, in Master Dong's book, originally published, he said in his preface of his book that there are about 740 points, but in his original book, he's publishing about 200. So there are more points to learn, but our course will give a very good foundation how to start and to go deeper and to learn more points.
Yeah, and thank you for your answer. And that it's true. According with the principles, I have been there and to translate the first year, and definitely the way you both show the process of learning and to memorize, make it is clear, because there is a lot of information to memorize, but it's a kind of add on the system of TCM channel, right? Theory, the jingle theory. So thank you. This is the first question. The second.
I just want to say one other thing.
Sorry,
Don't forget that there's also the app that is like a tool.
I have it here. Look, if one click and it will jump. Look, one click and it's here. Everyone can see the app.
So with the app, you don't need to memorize anything.
Memorize that, yeah. Okay, you just come and you just explore. Imagine that you are, say, pain above the eye, and then there are options. And the options can be used, if I understand it correctly, by the knowledge that the practitioner has according with the 5 zang that has the disease. So
according to the principles.
Yeah, the principles, as you were saying. So I would like to show that the structure of the learning process has much more information and can be used on the way of the reaction area, how to prick, how to put the needle, the benefits, and you can even have more information according with different aspects of the point. And the meaning of the name has been an amazing, for me, it's a very, very powerful tool to keep lifelong journey to learn. So I would like to share this, the technique, and I believe we will see it here, how we can see the technique to identify. It's an amazing app, and I believe everyone that starts this journey will have the opportunity to experience, because it's very, very, very good tool on the clinical daily practice. One more question that we received was, should I forget the massage and the techniques that I learned, and should I just jump in on tongue acupuncture and forget everything? What's your answer to this question?
So there are 2 approaches you could go by. That's not one approach. The first, normally when you learn something new, you combine it you add it to what you're doing until that time. But there is also opportunity, as going into Master Dong's acupuncture and understanding it more and more, that you'll find yourself just doing Master Dong's acupuncture. But it's a kind of acupuncture that you could also use together with what you're doing right now. It's if it's TCM, because we teach a 5 zang approach, so that's basically TCM. So you could just use it together with what you do, or slowly you'll start using it by itself. Both of the approaches are okay.
I'm just doing questions. That's
And about manual therapy, I mean, if you're doing manual therapy, it's great. I mean, no problem to combine it with tuina or shiatsu massage, or if you do it before the treatment, before the needles or after the needles. But I think you'll be surprised how powerful only the needles can bring in musculoskeletal conditions. And then maybe you don't need to use so much of your wrists and power and strength of your muscles, and you can maybe see 2 patients in 1 hour, and you can work even faster and better without working physically hard. But if you really like the profession of of massage and touching the body and and manual therapy. So it's can be combined great together.
The other question was, this method is more painful than traditional acupuncture because the needles are put in different areas of the hands. How do you respond to this question? I don't think so, but I would like to listen to the experts.
Well, definitely the 1-1 area, the fingers, and the 2-2 area, the palms, are more sensitive area by anatomy. It's just an area that we have more peripheral nerves and more shallow needling. But this is why this course is very much like a hands-on course, very comprehensive course, because we're going to practice a lot, and we're going to teach you how to needle this areas, and we gonna use all kinds of very small thin needles, because again this area is very superficial, so we don't need to penetrate very deep, and we don't need to use very thick needles, and sometimes even very gentle stimulation with press tech needles or seeds even can be very effective. And in the end, practice makes perfect. So if you practice, I think everywhere we taught together, Shaun and I, in England or in Portugal, I think one of the feedbacks of all the students were that they also learn how to needle better. So I think we're going to practice all of that. And this is, I don't know about the statement, if this is considered to be more painful than the rest. I mean, it really depends on your technique and your skills. I don't think it's more painful than standard TCM or acupuncture in general. It's just learning different areas, and for sure that won't be a problem to my experience anyway.
Any add, Shaun, or it's okay?
Yeah, it's okay.
It's okay.
I think
Yeah.
you answered.
The next question is for you, Shaun, that is related with VAS. That is, can you explain a bit of the VAS methodology and how it was born, and how it will be integrated in the second day with the the palmar diagnose in your advanced course, please?
So yeah, the vascular autonomic signal comes from auricular medicine. And I think it's one of the biggest discovery of our generation in acupuncture. It's just some amazing way to know which points are active, because not all the points are active all the time. And the truth is that the points are becoming active, they are responding to the disease. And so the points are becoming active because the body is imbalanced. So knowing to find the active points is a very, can really bring your results to a much higher level. So the vascular autonomic signal is a way to discover which are the points active using the pulse. But it's not the Chinese pulse. It's a different kind of pulse. It's a pulse that happens all over the body, on all the arteries. But normally we take it at the radial artery, like the Chinese pulse. And after stimulating an acupuncture point with a needle or with all kind of different equipments, it could be a laser, it could be a magnet, it could also be electric current. If the point is active, there's a change in the pulse. The pulse becomes bigger. So this technique really helps you to also diagnose and also to find the right points to treat. So I actually started using the vascular autonomic signal using palm diagnosis. And it helped me to improve my palm diagnosis skills. But after that, I started to use it on also the body, on all the acupuncture points. So basically, in the seminar, I'll be teaching you how to use this incredible way of finding active points. And you'll be able to implement it on, doesn't matter what you do. If you use TCM, And if you know auricular, use the ear, because it's very, very good for the ear. You'll be able to use this signal. It's a signal that helps you know if the points are active. I think I've taught this already for at least 5 years, and I've seen the people that I've seen a big change in the results that my students are getting. And what's special about the seminar, that the first day we do bloodletting, and then afterwards we learn palm diagnosis, and we start learning to use the VAS. And then the third day and at the end of the second day, we'll start seeing how to implement it in the clinic, how you see a patient and use this technique on Maso Dong's acupuncture. This is intended for advanced people that know Maso Dong's acupuncture already, because we could use this technique also to diagnose through the 88 and 77 areas. Because in Maso Dong's acupuncture, that's what's very special about Maso Dong acupuncture, that we have we use the thigh a lot, and I think that's one of the main principles in Maso Dong's acupuncture that makes the system very powerful, especially in treating internal medicine. So we could use the groups. There are like main groups of the 5 zang. Using the VAS, we could scan these points to see and which points are active, and the points relate to the organs. And through that, we could also diagnose. So we're going to learn also how to diagnose using the hip and the 77 area. So we'll give you a more tool to diagnose and to treat, because you treat straight away the points that you are finding. If I want to say this one other idea in Maso Dong's acupuncture, there's the idea that the points are not in accurate places. Okay, it's not like in the textbook. That's why in Maso Dong acupuncture, I'm talking to maybe people that already know Maso Dong acupuncture. We are treating areas. It's called a dauma. And in these areas, the points can move. They're not like in the textbook. And to master Maso Dong's acupuncture is to know how to find where to needle in the area. And the VAS, this helps you find this very easily, to know where to needle, because you could just scan the group, the channel, and see where the channel is active and know where to needle. So I think the VAS, vascular autonomic signal, that came from auricular medicine, it's really resonates with Maso Dong's acupuncture.
Yeah. Thank you so much for your clear answer and ability to integrate all the systems and all the methodologies we will use during those 3 days. And as an advanced course, there is some request that is knowing a bit in order to get more and more information during the course. Now I will open to someone that wants to do a question on the chat. You just have to write it down. If not, I will just share the images we have on the advanced course here on what we are talking about: bloodletting, palmar diagnosed, and clinical application of the use of VAS method. And then we have the other image here that is, sorry, like here. Well, when we have foundations, and where do we learn more than 200 points, and the principles of selection, and how to use the 5 zang methodology to enrich all the TCM knowledge that the attendees already have. If no one has any question, I would like to say thank you to Shaun and Gil for your time, and I hope we can see you online first in November and then presential in December. Have a nice
you,
evening,
Pedro.
everyone. Thank you for attending. We will keep in touch on the next APAMTC Talks. Obrigado e boa noite. Now it's your turn.
Obrigado.
Obrigado.
Thank you. Thank you so
Thanks,
much.
Pedro.
Welcome.
Bye.
We will stop.
Bye.